So a very good morning.
Good
I'm
morning.
Rajdeep Kaur and I am your student nurse for the day, and today I am here to do a head-to-toe examination. So before starting, can you tell me what is your name?
Surinder Pal Singh,
Okay, so can you tell me your date of birth?
11 August 1969.
Okay, so I am here to do your head-to-toe examination in order to find out any deviation from your general well-being. So to start, I need to know one thing. Do you have any pain?
No.
Okay, so now I will provide privacy to our patient, and now I will start with the neurological assessment. So, can you tell me what time it is?
The morning time,
Okay, can you tell me where we are?
at home,
Okay, can you tell me who I am?
my nurse.
Okay, so here we can see the patient is oriented to time, place, and person, and now I will start with the neurological assessment where I will assess for the cranial nerve, third that is oculomotor, fourth that is trochlear, sixth that is abducens, and seventh that is facial nerve. So here I want you to smile for me. Okay, so can you raise your eyebrows? So now I want you to close your eyes and tense the muscles of your eyes. And when you do so, I will check for the resistance. Okay, so patient has a normal resistance. So moving forward, I want you to cover one eye and tell me how many fingers.
1,
Okay, and now cover the other eye. Can you tell me how many fingers?
2,
Okay, so now I want you to focus on this pen, and when you focus on this pen, do not move your neck, only follow the direction of pen with your eye movement only. Are you ready?
yeah.
Okay. So now I want you to look at the wall behind, and while you the time you do so, now I will bring this pen toward your nose, and when I will bring this pen toward your nose, I need you to focus on this pen. So are you ready?
Yeah.
Okay. So the bilateral accommodation of the patient is normal. So now I need you to focus on something on the back. Okay. So in neurological assessment, we have seen that the patient has complete orientation to time, place, and person, and patient's verbal communication is also clear, and patient is able to follow all the instructions. So patient is completely well oriented, and all the cranials are working normally. So and the patient has a normal perla, that is the patient's pupil were round, equal, round, reactive to light, and were well accommodated. So next, moving forward, I will start with the respiratory system. So firstly, on the inspection, we can see that the patient has a normal expansion and contraction of the chest wall, and patient is very comfortably breathing. Patient do not show any signs of labored breathing or nasal flaring. So now I will go for the auscultation. So here I am going to check for the breathing sound. So every time you feel my stethoscope on your chest, just simply take a breathe in and a breathe out. Are you ready?
Yeah.
Okay. Okay, so now we will do it on your back. Can you move forward? Okay. So now I will start on the back. Okay, so now you can sit comfortably. So during the respiratory assessment, we have seen that the patient is breathing properly and there is no labored breathing or nasal flaring. And apart from that, I have heard no adventitious hard sounds such as wheezing, fine crackles or coarse crackles, and only a fine breathing, loud pitched voice can be heard while when I was listening through my stethoscope. So moving forward, now I will go with the cardiac assessment. So in the cardiac assessment, I will assess for the four valves, that is aortic valve, pulmonary valve, tricuspid valve and the mitral valve. So in the aortic valve, it is in the second intercostal space to the right sternum border, and in the pulmonary valve, it is on the second intercostal space toward the left sternum border. Tricuspid valve is in the fourth and fifth intercostal space toward the left sternum border, and the fifth, that is the last one, that is the mitral valve, where the apical pulse can be heard. It is in the fifth intercostal space, that is on the mid clavicular area. So now I will start with that process. So the apical pulse is 35 beats in 30 seconds, and during my assessment, I have heard no other adventitious hard sounds such as S3 or S4 or murmurs. Only lub and dub can be heard during the assessment. And moving forward, now I will start with the abdominal assessment. In this assessment, I would like you to lay down.
Okay.
So on the first inspection, we can see that the patient has a normal contour, and the patient has no bulging to the one side. There is a proper symmetry in the abdominal region. And now I will start with my process of auscultation. So now I will palpate. So while I am palpating, I am going to ask you a few questions about your voiding and bowel movement. So at what time had you voided today?
Around 6 o'clock.
Okay. So the amount of urine was normal or less?
Normal.
Okay. So did you have a bowel movement today?
Yeah.
In morning or what time?
Morning.
Okay. So do you go to bowel every day?
Yeah.
Okay. So now you can sit. Okay, so on inspecting on the abdominal region, I have known that patient has a normal voiding and the bowel movement, and during the auscultation, the patient has normal bowel movement, sounds can be heard, and apart from that, while I was palpating, I was able to find no lumps and no tenderness was found, and patient felt no pain during the process. So now I want to do some I want to check your extremities, upper as well as the lower. And during this process, first of all, I would like to see your hands. Can I see your hands? Okay. Okay. So the skin color of the patient is normal to the ethnicity. On inspection of the fingers, we can see there is no deformity. The nails are good. There is no clubbing of fingers can be seen. And the capillary refill is also less than 2 seconds. So now I will check for the pulse. So the pulse has a regular rhythm. It has the strength of +2 and it is equal on both the sides. Okay, so now I want to check the movement. So can you do some exercises for me?
Yeah.
Okay, so can you move your arms outward? Okay, can you move them back inward? Okay, so now I want to move your elbows toward your body. Can you move it away? Both the arms. Okay, move it back. Can you rotate your wrist? Okay, do you feel any pain while doing it?
No.
Okay, so now can I see your hand once again? So the patient targeted is also normal. Now I want to close your eyes. So I will write an alphabet on your hand. You have to tell me which alphabet was it.
B.
Okay, it's correct. Now I want to check for your strength of the upper extremities. I want you to clench your arm once again. And now I will pull it, and you have to show me resistance. Okay, so the patient has a resistance strength of 5 out of 5, that is considered to be normal. Other than that, patient has a good circulation and was warm to touch. The skin turgidity and integrity is maintained. There is no edema, no lesions to be found. The rhythm was normal. The strength was +2, and apart from that, it was equal on both the sides. Now moving forward, I need you to lie down. Now I want you to lift your one leg. Keep it back down. Can you lift the other leg? Okay, so while you do so, I want you to bend your knee. Okay, I will move it inward. Do you feel any pain?
No.
Okay, let's rotate it internally. Do you feel any pain?
No.
Okay, now?
No.
Okay, perfect. Keep your leg down. Can you lift the other leg once again? Now I will put resistance. You have to resist me, okay? Okay, you can put it down. Now I want you to twist your feet toward yourself. Can you do it? Okay. While you do so, I will put the resistance. You have to show me your strength. Okay, it's good. Can you move your feet outward now? Okay. So here on inspection, the patient feet are warm on touch. Skin integrity is normal. Keep them relaxed now. Okay. Now I am going to check for sensation. Now I am going to tap on your feet. Just let me know when you feel a sensation. Do you feel now?
Yeah.
Now?
Yeah.
Do you feel now anything?
No.
Now?
Yeah.
Okay. So now I am going to check for the pulse. So firstly I am going to check for the pulse, that is posterior tibial pulse. So here the pulse rate is normal. It is in a rhythm. The pulse strength is +2, that is considered normal, and it is equal on the both side. Now I am going to look for the pedalis dorsis pulse. So it is rhythmic, the strength is +2 and it is equal on the both the sides. Now you can relax. Thank you for your cooperation. So on the assessment of both the extremities, especially on the lower extremities, now I have seen that the patient has proper circulation. They were warm to touch. There is both the pulses were present. They were having the strength of +2. And apart from that, they were equal. There was no edema. There were no lesions on the feet of the patient. The patient has the strength of 5 out of 5, that is considered to be normal. The mobility of the patient was also seen normal. So here I am done with my head to toe examination. This was a complete procedure. Thank you so much.